Skin discoloration refers to any change in the natural color of your skin, and it's a common occurrence that can be caused by a myriad of factors. Now, when we talk about skin discoloration, we're essentially referring to any deviation from your skin's natural tone. This can be something you've had since birth, like a birthmark, or it can develop over time due to a variety of reasons. You see, our skin color is determined by a pigment called melanin, produced by cells known as melanocytes. When these cells, or the melanin they produce, are affected, it can lead to changes in our skin color, a phenomenon we refer to as skin discoloration. Infections are one such factor that can lead to changes in skin color. An infection can cause inflammation, which in turn can trigger an increase in melanin production, resulting in darker patches of skin. On the other hand, certain skin pigmentation disorders such as vitiligo can cause a decrease in melanin, leading to lighter patches of skin. Then we have more serious causes like skin cancer. Certain types of skin cancer can cause discoloration, appearing as new growths or changes in existing moles or freckles. It's important to note that skin cancer doesn't always manifest as discoloration, but it's one potential sign to be aware of. Skin discoloration can also vary greatly in terms of appearance. It can range from light to dark, appear in small patches, or cover large areas, and even differ in texture. This wide variation is due to the diverse factors that can influence skin color, from differences in melanin levels to underlying medical conditions. So, it's clear that skin discoloration is not a simple issue, but rather a complex phenomenon with a multitude of potential causes. Now, let's delve into some of the common causes of skin discoloration. Firstly, we have birthmarks. These are unique blotches on our skin that we are born with or that appear shortly after birth. They can range from light pink to dark brown, and their presence is mostly due to concentrations of melanin, the pigment responsible for skin color. Next, we have pigmentation disorders. Melanin, as we mentioned, is the main player in skin color. However, when the cells that produce melanin malfunction or get damaged, it can lead to disorders like vitiligo, where patches of skin lose their color, or melasma, where dark, discolored patches appear. Autoimmune diseases also play a role in skin discoloration. Lupus, for example, can cause a distinct butterfly-shaped rash on the face. Rheumatoid arthritis, on the other hand, can lead to paleness or a bluish color in the fingers or toes. Infections are another common cause. Certain bacterial, fungal, or viral infections can lead to changes in skin color. For instance, the fungal infection tinea versicolor can cause small, discolored patches of skin. Allergic reactions too can cause skin discoloration. Contact dermatitis, for instance, can cause red, itchy skin, while a severe allergic reaction could lead to hives, red, raised, itchy bumps on the skin. Lastly, we must mention skin cancer. One of the most telltale signs of skin cancer, particularly melanoma, is a change in the color, size, or shape of a mole or freckle. Each of these causes has unique characteristics and effects on our skin. They alter the color of our skin in different ways, through the production, distribution, or destruction of melanin, or through inflammation and other immune responses. Understanding these causes is the first step towards diagnosing and treating skin discoloration. How do professionals diagnose and treat skin discoloration? Let's explore. Diagnosing skin discoloration is a meticulous process that begins with a physical examination. Healthcare professionals look closely at the affected area, taking into account the color, size, shape, and texture of the discoloration. They look for patterns, noting if the discoloration is localized to one area or spread out. They may also take into account factors like the patient's medical history, lifestyle habits, and potential exposure to harmful substances or allergens. Following the physical examination, diagnostic testing may be conducted to delve deeper. These tests can range from simple blood tests to more specific ones like skin biopsies. The goal is to identify any underlying medical conditions or disorders that could be contributing to the skin discoloration. Once a diagnosis is established, the treatment process can begin. The treatment for skin discoloration is as varied as the potential causes. It may involve medication, particularly if the discoloration is due to an underlying medical condition. For instance, antibiotics may be prescribed if an infection is causing the discoloration, or antihistamines if it's an allergic reaction. Topical treatments are another common approach. These could include creams or lotions designed to lighten the skin or to treat specific issues like acne or eczema. In some cases, these treatments can be purchased over the counter, but stronger versions may require a prescription. Finally, cosmetic procedures can also be considered, particularly for discolorations that don't respond to other treatments. These procedures can range from laser therapy, which targets specific pigments in the skin, to chemical peels or microdermabrasion, which remove the top layer of skin to reveal fresher, more evenly colored skin beneath. Remember, treatment isn't a one-size-fits-all solution. It's tailored to the individual, taking into account the type and cause of the discoloration, the person's overall health, and their personal preferences. The appropriate diagnosis and treatment can make a significant difference in managing skin discoloration. When it comes to skin discoloration, professional consultation is crucial. This isn't just a statement. It's a mantra that everyone should live by when faced with something as complex and potentially serious as changes in skin coloration. You see, skin discoloration can be a symptom of a myriad of conditions. It could be something as simple as a birthmark or a pigmentation disorder, but it could also indicate something more severe like an autoimmune disease or even skin cancer. This wide range of possibilities makes it incredibly difficult, if not impossible, for a layperson to accurately diagnose the cause of skin discoloration. Therein lies the risk of self-diagnosis. The internet is a vast resource filled with information, but it's also a minefield of misinformation. When you attempt to diagnose your skin condition based on what you read online, you run the risk of misinterpreting your symptoms, leading to incorrect conclusions. This could result in unnecessary panic or worse, complacency towards a condition that requires immediate medical attention. That's where professional consultation comes in. A healthcare professional has the knowledge, experience and resources to accurately diagnose your condition. They can perform physical examinations, run diagnostic tests, and interpret the results correctly. Armed with the right diagnosis, they can then guide you towards the appropriate treatment, be it medication, topical treatments, or cosmetic procedures. Apart from accurate diagnosis and treatment, consulting a professional also gives you the opportunity to ask questions and gain a better understanding of your condition. A healthcare professional can provide clear, concise, and accurate information, dispelling any myths or misconceptions you may have come across in your own research. In essence, the benefits of professional medical advice are threefold: accuracy in diagnosis, appropriateness of treatment, and clarity of information. These benefits not only ensure that you receive the right treatment, but also help alleviate any anxiety or confusion you may be experiencing. Remember, your skin is the largest organ of your body. It's a vital barrier protecting you from the outside world, and any changes in its color or texture should not be taken lightly. Never underestimate the importance of professional advice when dealing with skin discoloration. As we wrap up, it's important to reflect on the significance of understanding skin discoloration. This isn't just about aesthetic concerns or vanity. It's about recognizing that our skin, the largest organ in our body, can signal changes that might be happening beneath the surface. The hues and tones of our skin can sometimes be the first clue to an underlying health condition. From pigmentation disorders to infections, autoimmune diseases, and even skin cancer, discoloration can be a sign that our body is trying to tell us something. That's why it's crucial not to dismiss these changes as mere cosmetic issues. If you notice any unusual patches or changes in your skin tone, it's important to take action. Seek professional advice, get a diagnosis, and follow the recommended treatment. This isn't about fear, but about empowerment. Understanding skin discoloration leads to better health and well-being. It enables us to be proactive, to take charge of our health, and to make informed decisions. Remember, knowledge is power. The more you know about skin discoloration, the better equipped you are to manage it.